Hello and welcome to the All Things Social Impact podcast. I'm your host, Andrea Kanaris, and today we're joined by Amanda Mather. Amanda, would you like to introduce yourself and tell our viewers and listeners a little bit about your background?
Well, hello, and thank you, Andrea, for inviting me along today. My background started quite a long time ago in the community sector, back in the Department of Housing. I've worked across a number of government departments, including Public Works and Queensland Health. In the mid-2000s, I did move into Queensland Health and worked on the Queensland Children's Hospital project, which is a very proud opportunity for me. I got to write the health service plan for that hospital and the impact on the surrounding hospitals for improvement in services for children. So that was really great to see that project come to fruition and to see what a success that hospital's actually been into the future. From there, I moved into aged care, and I've worked in aged care for a number of years in leadership roles at an operational level, and I also currently sit on the board of TriCare Aged Care, which is one of the largest aged care providers in Australia, where I'm the chair of the board. So I'm right in the mix of all of the changes that are happening in the aged care sector right now. I've also had a long career in disability. I worked for a number of years with a beautiful charity called Hear and Say, and loved all of the work that they were doing to support helping children with hearing loss to listen and speak and live a full life in the community. And more recently, I was the CEO of Sporting Wheelies, which was a really fabulous role, looking after our Paralympians and supporting our Paralympians on their journey to the Paralympics, but also supporting grassroots sport for people with disability, which is very much overlooked. In that role, I was actually able to build Australia's first parasports clubhouse, which is a real achievement. And we've got that clubhouse in Brisbane at Milton. And it's been a real beacon for people with a disability to find their sport, which is not often seen or heard of in the community. And now I find myself as the CEO of Transit Care. Transit Care is one of the largest community transport organisations in Australia and plays a very vital role in connecting vulnerable people with their community. So whether you're an elderly person living at home and you need to connect with your local medical appointments or shopping, or whether you're living with a disability and you're looking to connect, Transit Care is a provider that actually understands the needs of people with a disability and the elderly and transports people safely and without fear and in the community. So I'm really enjoying this next phase of my career and looking forward to what impact I can have on the community in this transport space.
Oh, fantastic. The connector piece is really interesting, isn't it? It's such a great body of work. I was very excited when you agreed to come on the podcast because there are some synergies between our backgrounds. There's very much a lot of what you talk about really is what inspired my journey down to developing all things social impact as a company, but also the book and this podcast. And it was breaking out of this idea that a social impact practitioner is this very narrow focus. And I think your journey and what you do really speaks to that. You have worked across various departments, and all of the issues that you address are things that social impact practitioners that might be listening would grapple with in every single project in the different contexts. But what underpins it is the social issues that you have dealt with across your career. So it's really exciting to have you on. We have shared the history, as we were talking about earlier, around housing and health, and you had some really interesting things to say, particularly about the contemporary issue with the housing crisis the way it is, and the work you were doing back when you were working in housing, which was, if I remember correctly, was the 90s. And what you said was really, really significant. And I think it's really important for our listeners to hear because it really talks about legacy. It talks about sustainability in a social context, not an environmental context, because it's different.
Yeah.
But your example really speaks to what sustainability actually looks like in the social space.
Yeah, well, back in the dark ages, the 1990s, the pre-internet and pre-social media days, I was designing and building home lending products for low-income earners. So we were using back then some really innovative ways of financing home loans and supporting people with low incomes and low deposits into home ownership. We had options like ballooning debts, which at the time was really quite risky, because as much as today we know that housing prices have increased, back in the 1990s, we didn't know if housing prices were going to increase, but the models actually were designed for that increase. And I shared with you, Andrea, I feel very proud that I can say, hand on heart, that I have helped probably tens of thousands of low-income earners become millionaires in the years since the 1990s as the value of properties have increased. And as I mentioned, the big issue for me is that public housing, or living in public housing, we often say is hereditary. If your parents are in public housing and you grow up in public housing, it's a very high chance you will end up in public housing yourself. So if we can help people out of public housing into home ownership, that will have a flow on for generations to come, and support those generations in their own growth in the community.
And I really love that, because it really gets to the causation. It's understanding the causation. You weren't as much about focused on the outcome as you were from removing the barriers to people to allow them to thrive. And it is an amazing thing to know, like you said, because the price of housing has gone up so much since the 90s. The people you help, then you release them from this trap of generational cycle of repeating long-term reliance on public housing, which I
And
think is
potentially
amazing.
create intergenerational wealth, which is, that is the great divide in our communities right now, is the haves and the have-nots. If you have parents who, own their own home and, live in their own home, then those children are more likely to be able to navigate the pathway to buy their own home. So it creates that intergenerational wealth, and that intergenerational impact, I think, is just so important.
Yeah. And, we've managed to commodify housing, and we've forgotten that it's one of the basic human needs. It's, if we want people to care about the environment, for example, and climate change, then we have to actually first make sure that we start at make sure those base needs, hierarchy of needs, are met. And
That's right.
housing is essential to that. And the other one is health, which you and I both, again, shared. Would you mind telling a little bit about what you've done with health? Because I always say, health is absolutely critical, because if you don't have health, you really don't have much, because everything else, it's hard to think past, trying to get better. That's kind of, your world becomes about how to get through each day, depending on how sick you are. But if you don't have your health, then it's pretty hard to think beyond that. So would you like to share some of your health experience? Because that is a huge body of work
Yeah.
that you've got there to share with people.
Absolutely. So my journey through health was in a number of ways. So I started off actually at Queensland Health as the Director of Innovation, which is a fabulous title. And it was actually quite interesting in that space, because what we were trying to do is find out what were those grassroots innovations that were happening every day in hospitals that we could actually then spread the word across others. And I can remember, and I'll share this, it's a bit off topic, but I'll share it with you. One innovation particularly that I really loved was a nurse who was working in a really remote hospital, and often nurses in remote hospitals are working by themselves, and so it's a struggle to try and keep the wheels turning. And this nurse came up with an innovation that she would use zip ties to keep the IV lines from getting tangled. And so we then spread that message across Queensland Health, and I reckon we saved probably hundreds of thousands of hours of nursing time in trying to untangle IV lines, just simply by adding zip ties to keep them sorted. So, innovation happens I love innovation, and it happens in sometimes the most unlikely spaces, but can really have a huge impact.
And not necessarily as sophisticated as everyone thinks it needs to be. That
That's
needs
right,
to be
exactly.
really complicated. Sometimes it's really simple.
Yeah. And look, from a health perspective, I guess the biggest piece of work I did was with the Queensland Children's Hospital project.
Yeah.
And on that project, my role was designing and developing and designing the health service plan. So that involved analysing copious amounts of data to determine what were the current clinical conditions that we needed to support, but also where we're heading in the future in terms of what other conditions could be impacted in the future. And one of the things that we discovered was that because of technology and because of all of the work that had been happening around medicines and interventions, that childhood diseases were no longer just childhood diseases. So kids who weren't expected to live beyond their childhoods were now living into adulthood. And so the design of that hospital actually needed to consider how other hospitals in the regions and around Brisbane could also support this change in the types of health conditions that we needed to look forward to in the future. And so from that health service plan, we supported funding for improving access to healthcare in the regions for children, and certainly building capacity in those adult hospitals to support that transition from childhood diseases into adults, and supporting the growth of those children and supporting them through their adulthood.
Yeah.
But I will say probably my most interesting experience in the health sector happened when I was working in Hear and Say, which is a beautiful charity that specialises in teaching deaf children to listen and speak. And one of the issues that I came across in that space is particularly with our Indigenous population, and that is around otitis media. Now, we don't often talk about that, and basically otitis media is recurring middle ear infection. But our Indigenous population in Australia suffers that condition more than any other population anywhere in the world. And just to give you an example, the World Health Organization indicates that any more than 4% of a population that has otitis media is a critical health issue in the world. The second highest proportion of the population with otitis media in the world is around about 5% of the population with otitis media. In Australia, amongst our Indigenous population, it sits between 30 and 40%.
Yeah.
So we are we have to solve this problem, because if a child has otitis media and they go to school and they can't hear, they're labelled a troublemaker, labelled a slow learner, and where do they go? What happens to them after that? So if we can start to support kids early, give them the right health support to navigate it with their families, those conditions, hopefully that will end up in a better outcome for our communities as well.
Yeah, and I think otitis media is a perfect example. But when we're talking about the Indigenous Australians, they're so behind. I think in the goodness knows how many years now, making tracks and in closing the gap, we have not closed the gap. I think there's one metric where we've actually made progress, and that's shameful. I really think for some reason we tackle the Indigenous issue, and I'd be interested in your thoughts on this. My view from when I watch it is, why are we're not meeting them where they're at? We're coming up with solutions with somebody who's sort of up here, and they're not recognizing they're down here, and there's that discord, and it's almost like the programs or the investments that we're making are sort of doomed to fail.
Look, I think what we're trying to do is everything all at once, and that's why we're failing.
Yes.
I think what we probably need to do is follow my career, build the houses, build the infrastructure, maintain the health, and then support the disability.
Yeah.
Empower people to be able to live their lives. But because we're trying to fix everything all at once, I think often we don't actually make any impact in one particular area. It's kind of like we're spreading ourselves too thin. And I feel as though, from my experience, if we were to pull back a bit on how thinly we spread the amount of dollars that we've got, and actually go, well, you know what, let's really focus on improving housing, because housing, as we talked about, is really the base human need. If we can solve housing, that actually has a flow-on effect to otitis media. Better housing, leads to better health outcomes, and, so then supporting those health outcomes, and then supporting access to employment, and in my current role, transport, which I'm very passionate about now.
And in some of those rural and remote areas, the transport cannot be they live in, and I think unless you've been to some of these places, you hear remote and it doesn't really mean anything until you've been out there and realize how far removed they are from any services, infrastructure, support that may be available. It's not just that it's distance. The terrain can be complex, difficult, challenging to overcome in itself. You have the seasonal
transport. Transport disadvantage can occur anywhere. It can occur certainly in remote areas, but it also occurs in our own cities.
True. So
we will have Indigenous populations living in cities who have transport disadvantage, because although we have 50-cent fares, getting to the location to catch the 50-cent fare is a disadvantage in itself.
Yes.
And if you have additional disabilities or conditions that preclude you from being able to catch the public transport, then the cost of those individual transport options are hugely expensive and out of reach for many people. So that's where the community transport sector comes in. But the government really needs to step up and invest more in the community transport sector so that we can help more people access the services and supports they need.
That's a really great point, Amanda. And, transport, there's so many layers as to why we've ended up here. There's the planning in terms of allowing, developers to build in the middle of nowhere for these houses, and people go there because they're affordable. However, then there's no infrastructure. And I often say, anyone that's saying that Brisbane has got great transport are the handful of people who happen to live on near a bus stop or a train station. Because if you don't, we're quite a geographically spread out large area, and there are lots of people who, even in the city, can take over an hour to get to the city because it's not an easy,
Yeah.
People ask why are they driving. It's like, well, it's six one half dozen of the other. They're either going to be stuck trying to get transport which is inefficient, not nearby, or stuck in their car, which is also expensive.
And I certainly think if we are looking at Brisbane 2032, which is on our radars at the moment, the legacy that we can do for 2032
transport.
is to impact transport disadvantage. We've talked for many, many years about making transport more affordable. Well, I think the government's done that. 50-cent fares is not much more they can cut from that. But what we have to do now is actually make it accessible, and get people who may not be able to access transport in the normal ways, be able to access appropriate transport for them. And I often talk about the difference between equity and equality. So the 50-cent fares have given equality to everyone. Everyone can access 50-cent fares, no matter who you are, you can get a train ride for 50 cents. But the equality comes into it. Equity comes into it when you think about, well, what's right for each person. For the majority of the population, yes, the 50-cent fares will work great, but there are still people who live with disabilities or with other mobility conditions where they just cannot access those services, and they require supports, equity, to be able to access those services.
Yeah, it's removing those barriers and providing a service that actually, meets people where they're at, provides. And what's really interesting too, like with the 50-cent fares, I was personally furious about the 50-cent fares because I'm like, the money's not the issue. The transport, the only people who have benefited from that are people who already have access to transport. You haven't solved the actual problem. The actual problem is not, the existing train lines or the existing bus service, although there may be some issues there. The ones that they didn't look. I would rather them have spent that money that they're so-called saving and actually try and solve the problem, provide better services, provide more services to more remote areas or inner city areas that don't have access to transport, and look at those solutions.
I mean, the 50-cent fare.
People will pay the fares. People will pay the fares if it solves the problem for them. So, for example, they're not going to get in their car if there is a transport option at the end of their street or nearby or within a reasonable distance. And this is borne out in big cities that do have good transport systems. If it is nearby, if it is efficient, they will pay the fare. But it's
And
got to
we know, people who've travelled overseas have seen fantastic transport systems in action because, when you travel and you're using those public transport options, you can see what great connectability in public transport actually looks like. We are a long, long way away from that in Brisbane. That doesn't mean we can't get there. I think we just need to start setting a plan for how we are going to tackle that problem.
I agree.
And start to move forward. I'm not angry at all about the 50-cent fares. I think actually what 50-cent fares does is actually makes it more equitable in some ways for people who live in those suburbs way outside of the city centre. And it's a very Brisbane-centric benefit, the 50-cent fares. But people who live out of suburbs who are paying $100 a week to get to the city to work are now paying a lot less than that. And it's making, cost of living for them more affordable. To invest back into their communities as well. And it actually makes the potential to live, further out from the centre of Brisbane a lot more enticing for people as well, because they know that the cost of travelling to their place of work is greatly reduced. So I think from that perspective, the 50-cent fares have had a great impact, but it hasn't been impactful for everyone. Certainly in the regions, it's made no difference at all, because there isn't good transport options in the regions anyway. And then when you talk about people who are living remotely in some of the remote parts of Queensland, there's no benefit at all for them, and that's where community transport really needs to be supported to grow.
Yeah, and I'm a believer, and the reason it makes me angry is not that I dispute that, obviously there's cost of living pressures at the moment. I guess for me as a problem solver, I'm like, this has not even scratched the surface of addressing the transport issues in Brisbane. And, I live on a train line, so I benefit. So I say that being one of those people who benefits from it being at the end of my street. And that's, I guess, probably what fuels my anger. It's like people like me, we didn't need the 50-cent fares. We're not the problem. We're not beneficiaries of the problem. We just get we go, yay. But meanwhile, the person's going, well, great, that doesn't help me any at all. So, but what the other thing I'd like to pivot on health is, and this is a thing that I'm very strong on, and which is the social determinants of health. And this is that intersection between, and I think you talk about it in all the examples that you've used, is understanding the problem. I believe social determinants of health are really core to that. How have you used it in your work, and how do you think that it links to things like climate and infrastructure, which is probably the two big things at the moment as we transition to renewables? How important is it, do you think, that social determinants of health really inform the future of, say, renewables, the developments and the infrastructure that goes along with it?
Yeah, look, I think obviously I'm just moving into the transport sector in my new role, and I can tell you that we have a fleet of vehicles that are all hybrids, so we are doing our bit for that sustainability. I think social determinants of health means a few things for me, and it's not necessarily always linked to the environment. I think socially impacting people's health has flow-on effects to the culture of a community. And I'll give you a bit of an example. When I was working with Here and Say, I went along to a breakfast one day and I sat at this breakfast next to the Commissioner for Corrective Services. And I thought, goodness me, what am I going to talk to this man about? I work for a children's charity that specialises in hearing loss,
Yeah.
Anyway, I turned to him and I said, so how many people in your prisons have a hearing loss? And he looked at me and said, well, I don't know. And I said, well, wouldn't it be important to know? Because if they can't hear, how do they navigate the legal system? How do they hear, commands or, the things that they need to do in the system? And he just went really quiet and said, look, I'd never actually thought about that before. And I said, I'd love to talk to you more about it. Anyway, back and forth, a few conversations. He actually asked me to do a study on the prevalence of hearing loss and intellectual impairment in Queensland's prisons. And we did a 6-month study around Queensland. And the results were were remarkable in a terrible way. Prisoners were 5 times more likely to have a hearing loss than the general population. And amongst the Indigenous prisoners, they were 50% of them had a hearing loss.
Right.
I think, knowing that, and you talk about social determinants, I go back to the conversation I had about the child sitting in a classroom with a hearing loss, able to slow learner, labelled a troublemaker. Where do they end up?
Yeah.
Unfortunately, the data tells us that, many of them will end up, in our corrective system. Now, that's not the pathway we want to happen. So when we talk about health, we talk about the pathway for many of these, for these people, that pathway could have actually been changed right back in their very early years, in their early schooling years, through just navigating health options and appropriate health support for disadvantaged kids. So I think for me, when we talk about social determinants of health, I think about how you can support people to change the way they think about health, give them the appropriate care, give them access to the appropriate care, and support that lifelong journey to living a life that's contributing to the community in a really good way.
Yeah. And again, this is another perfect example of what sustainability can look like in the social space. And it's not always linked to climate or the environment. it's really linked to, it can be genetic, it can be diet, but you have to understand what it is that this person's or community's health profile looks like. So that, and the behaviors and the cultural drivers towards those behaviors, for example, drinking, for example, junk food. You will, if you're living in a society, community, or you're part of a community that is health driven, your determinants of your health outcomes and the way your life goes is going to be quite different to somebody whose cultural environment is a toxic soup of, bad diet, alcohol, maybe casual social drug taking. It's very different environment. It's going to
impacts mental
determine
health,
different outcomes.
domestic violence.
Correct. And, I think there's a very dismissive sometimes, or it's complex. So sometimes people sort of miss the fact that underneath there's actually data that sort of informs you how you might, want to address some of these issues. And they are complex and they are wicked problems, but you're never going to fix them if you're not looking at the social determinants of those.
Absolutely.
They certainly don't. They don't just appear out of thin air. And like you said, there's that intergenerational thing. And we can think of suburbs, that we all know of. There are areas that we see, not just in Australia or not just in Brisbane, but around the world, where there's this intergenerational reliance on public housing, on public, the public purse in terms of their income. They've got parents that didn't work and that took drugs and drank alcohol and were in violent environments. Their grandparents are the same. They go to school and everyone in their school is also, parents don't work. The kids, go to school, they don't go to school, doesn't matter. Nobody's really, supervising them. A child in that circumstance, you can almost predict, if they get out, you go, that they're the miracle child, not the norm. I think there are people who get out of that. There definitely is, but the chances are much lower when that's the toxic soup of environment that they're in. And these are all social determinants of health outcomes. And when I say health outcomes, I think when I say health, I think it's not just health. I think it's lifestyle, future. It's very hard. It's a very hard baseline to come from when your health is that poor.
Yeah. And look, if we wind the clock back a bit, in fact, my father has written a bit of a memoir of his life and his family recently, and I was reading through that, and I was just looking back at, 100 years ago, the key determinants of your future was, do you have an income and do you have a home? And I think, same issues today. If you have a solid home that you can call home, whether you're renting or owning, but it's a place that you feel safe and that you feel as though you have tenure, because that's the big thing for renters. They don't necessarily have that tenure. And also for mortgage holders if they're struggling to pay their mortgage. So if you feel safe and you have tenure, and you have employment that you can get to because you've got transport options. If we can solve some of those really basic things, I think sometimes we try and make it too complex by overlaying too many things. I think sometimes we just have to pull the layers back and say, even the earliest humans had two things. They had shelter and they had
food.
They had employment,
Yeah.
because that was how they got the food.
Yes.
Whether they were hunting it or gathering it or whatever, that was their employment of the day. We kind of need to, I think, with all of these things, wind back the clock and just, if you've got those basic things in place, then that's the base to propel ourselves forward. We've made living so complicated. It is so complicated to live in 2025. You might have a mortgage, or you might have, transport issues or disability, or we've made everything so complex. And I think we probably just need to peel back some layers, get back to what's actually really important.
Yeah.
And as I mentioned with the Indigenous issue, we've spread ourselves so thin trying to address everything all at once. We need to pull that back and for everybody address the basic human needs, which is shelter, employment, sufficient employment to be able to, put food on the table. The other thing that employment does is gives you a sense of purpose.
100%.
And so without employment, whether that employment is hunting and gathering or whether that employment is working at the local shops, that employment gives you a sense of purpose. And that's what makes you you. That's how our humanity actually, comes from employment.
I love that you made that link with employment, because in my space in particular, social impact, and it's something that I've seen emerge more recently. And there's what I've noticed is people saying like, oh, they're just going to say this, infrastructure, this project or whatever, it's going to provide jobs, and they roll their eyes. And I'm like, it's so dismissive. It's easy to say when you're the employed person, probably on a high income. So you've lost touch with the reality of the significance of the income that you're earning. So that's one thing, is that we've lost touch with it. There's lots of white noise. The other thing that I think has been really destructive around employment is work-life balance. It's a terrible term. It's a terrible concept, because I don't know about you, but when I'm at work, it is still my life. So
Yes.
this whole concept of the demonization of employment, and the reason I call it demonization is because now people see employment as the enemy. It's a bad thing. It's like, but really, when you peel it back and you look at what happens, and if you look at the data, because the data doesn't lie, 6 months, if someone's unemployed for 6 months, they used to say 12 months was long-term unemployment, and that's when you see depression. The data actually says it's 6 months. You look at retirement, for example, suicide rates go up through the roof. Once people, because it's like you said, that sense of purpose. And I would say it's more than just purpose. It's all those things you said. And I would add self-esteem, a
Yes,
sense of
absolutely.
pride, a sense of achievement, a reason to get up in the morning, to get dressed and get out the door, even when you wake up in the day and you're going, ugh, I don't feel great today. But you go to work and then and it's that
But it's also
connected.
a reason to make yourself feel well. It's a reason
Yes,
to go and get
exactly.
the medical help that you
It's a
need
purpose, a reason.
so you can be
Exactly.
somebody. Yes.
And then it's this wonderful thing, which has also been demonized, is the social connectedness you get at work. We're so worried about what people can say and can't say that we've lost the fact that the important thing is that we stay connected. Stop worrying about, if people used to meet their partners in the workplace, they used to meet some of their friends. I know some of my closest friends are people I have worked with, and thank goodness that I grew up in a time where we used to actually socialize at work, and we weren't told that we couldn't say this and we couldn't do that. We were allowed to be who we were. We didn't always get everything right, but we weren't demonized for having misspoke,
Yeah.
if that's what you want to call it. But I think the demonization of work is really poor, because I agree with you. It's one of those foundation pieces that we were talking about. There's health, there's housing, there's food, but the other thing is some employment, because that's the world we live in. And I love what you say about whether that be hunting and gathering or a paid job, because for some people, our traditional people, if they do choose to live off the land, that is their work, feeding their family, and it's their role in the community, their sense of belonging. They have a reason to get up and do things. And I
Yeah,
think that's an
absolutely.
important recognition.
I've just joined the board of ETC, which is an employment organisation that has operated predominantly in New South Wales, but is now moving into Queensland. And so I'm really excited to start contributing into that employment space as well.
Yeah.
Myself as an employer have, I call it lived experience as an employer, because in my job at Sporting Wheelies, when I started that role, we didn't employ anybody with a disability, and I thought, how could we be the peak parasport organisation for Queensland and not employ a single person with a disability? By the time I left Sporting Wheelies, 50% of the workforce were people with a disability, which makes me incredibly proud. And that doesn't happen just by shoving a person with a disability into an already existing role. It actually happens by looking at things differently, looking at work in a different way, carving up the work in different ways. And in the case of Sporting Wheelies, really challenging the norms around employment for people with disabilities. No one had ever employed someone with a disability as a coach of a sports team until we started saying, well, of course it's possible. Let's do that. We also created entirely new types of work, which created entirely new social enterprise for the organisation. So, there's ways in which we can support all people into employment, and everybody, no matter whether you are living with a disability or not, everyone benefits from having that, that feeling of I'm helping others and I'm needed in the workforce.
Yes. I couldn't, that's just so beautifully put, and what a wonderful example. And I think wasn't it Gandhi who said something like it's a society, you can tell the health of a society by how it treats its most vulnerable
Yeah.
people. And if you can find space and carve out space for the vulnerable people in your community, then then everybody else in the community benefits. When you don't, people will fall back on behaviors or doing what they need to do to survive. And this is where you will see increased crime. You'll then see, antisocial behavior. You will see divisions in your community, which is not what we want. We want cohesive, happy, healthy, thriving communities. And I love that example. I think that's just a lovely, elegant example of how you achieve that. And that kind of model, not that it has to be the same, but that kind of thinking and approaching, if you find yourself in working with vulnerable people, it's being creative and challenging yourself to look at it differently.
Absolutely.
So I'm conscious of your time, and
Yes, sorry, we'll have to wrap up soon.
I thought we'd finish by saying, for our viewers out there who might be pursuing uh, a career in social impact, I think this discussion in itself opens that window of what it can look like. But what would your advice to be them if they're on that journey? Based on your lessons, your learning, what would your advice to be them as they pursue that career?
Look, I didn't start off with a plan. I didn't start off with a plan to get a job in the Department of Housing and move into health and move into disability and where I move into transport and employment. I didn't have that plan. I literally just followed the universe in some ways, because what I did was I started where I was, and I say to people, wherever you are is a great place to start. But I've always stayed connected to my why. I've always been about helping people and supporting people and having a genuine commitment to really making a difference in the community, no matter where I was. And I guess I've always, and I encourage you always to learn and always look for opportunities and connections. So, who'd have thought that talking about hearing loss would get me to start to do work in Queensland's prisons, working for a children's charity. So, you've got to look for those threads that are running through the community, no matter where you are. Listen to the people that you're trying to support. Make sure that they are central to all of your decision making, but don't underestimate the power of partnerships and networks. Build your network. I have a wonderful network of past colleagues and friendship circles that I can draw on to support me in my journey. And I must say, everybody in their career goes through highs and lows, and I've had some lows like everybody else. And that network can be really necessary and supportive to keep you believing in yourself and believing that, the universe will take you to your next career, your next destination.
Yeah.
And I guess finally, my big thing is, don't be scared. Be courageous, be curious, but be authentic. And, don't shy away from the hard problems, because it's in tackling those hard problems where often the greatest impact lies.
Yes. Well, I think that is absolutely sage advice. It's brilliant. I'm sure our listeners are as happy as I am and glad that you agreed to come on this podcast, because I think for the people listening, the stuff that we talked about today is about social impact. I think everybody listening will come across these kind of issues in their work, but in their personal life. And that's what this is about. It's about connecting with people on a real level about how they experience the world and then how you can solve those problems. Thank you very much, Amanda. It is so nice to have had you on today. I really
Thank you for having
appreciate
me.
your time. Thank you.
Much appreciated. Thank you, Andrea.
Thank you for watching. And if you're listening, thank you for listening. Remember to hit the like button, share it with your friends, and subscribe. When you subscribe to the channel, I get more interesting guests and we can all learn, grow, and share our stories together. Thank you for listening. Remember, hit the like button, share, subscribe.